Uh, this is one of the um, best 1 hour documentary shows I can invite you to watch about fascia. It's on YouTube. It's only about 7 months old. So take a screenshot so you can watch this later. This is your homework for the month. Put your hand up if you've already seen this. It's remarkable. I don't want you to miss this. So all day long, I happily release tonic and tight facilitated muscles. I decrease densification in specific myofascial layers. I release trigger points. I bring in blood flow and nutrient exchange. I traction out deep connective tissue elements that are in dysfunction. And most importantly, the collagen cross bonding. And I mobilize the viscous brown substance. The radio frequency of Winback, it goes right to the thixotrophic effect. It helps decrease the hyaluronic viscosity. We get to tap into the gate control theory of pain. The large A beta nerve fibers that transmit superficial pain can inhibit those smaller diameter A delta and C nerve fibers that transmit the noxious pain. And we stimulate endogenous opioids and the endorphins that affect the limbic system in the brainstem, the enkephalins that affect the nervous system. So I did an experiment for a whole 2 weeks on every patient. I think you're going to like this, so stay with me. Every patient I saw for 2 weeks, I told them that I was using Winback to stimulate the healing. And I had my list, everything that I'm sharing, I pulled out of the literature for tissue repair, released a histamine-like substances that contributes to vasodilation, increased microcirculation, increased new blood vessel formation, neovascularization. I enhanced leukocyte infiltration. I increased macrophage activity, which is hugely important. I want you to keep that in mind. And we know we increase fibroblast and keratinocyte proliferation. We create early epithelialization. We even increase growth factor. And we know we get like a greater healed wound strength. So probably just like you are now, you might be a little glazed over, but let me share what they heard. This was the fun part for me because the most common complaints that I hear are joint and soft tissue pain with arthritis. Those are the biggies that I really see. And after I said everything on that last slide, I treated the patient and then I gave him a piece of paper with all of these choices, both sides, all of these choices. And I said, circle the top 4 things you heard us talk about this treatment. I quizzed him. And the top 4 were improved blood flow, improve oxygen, improve the muscle relaxation, and pain relief. Specifically, they would say, oh, you're doing this for pain relief for my shoulder. You're doing this for pain relief for my hip. You're doing this pain relief for my low back. So what's the point of me sharing this? That's all they heard. So I think if you say these things to your patient, that's important as far as our practice management goes, because that's really all they're going to hear, even though, we get excited about all of these other things, knowing that TECAR does. And what else, like I get really excited about it, that the physical energy, it causes a biological response that signals the eNOS, VEGF, the proliferating cell anti-nuclear antigens, and neovascularization to improve the local blood supply. So increased blood flow, it leads to improved bone repair and tendon repair, which this device is great for that. And I think that it can stimulate stem cells if you have stem cells available in the area that needs repair. Like I'm older than you guys. So I might need a PRP plus exosomes or other stem cells plus Winback boosting it before and after. I'm convinced that doing it before and after is actually helping. And it's by also raising the internal temperatures. That is something really important to the immune system. Maybe even for apoptosis and senescent cells activity. So like cleaning out debris. This is my favorite conversation about Winback. Literally, I like to be able to say it really invigorates the body to establish not only healing mechanisms, but can actually instigate a stalled healing process, like non-union bone fractures, or create removal of non-specific, tissues, the calcification or the scar tissue. Once you break it up, however you break it up, that we can promote regeneration and resolution of new tissue to that area. Winback has effects on biological tissues that increase tissue oxygenation, even total hemoglobin, and oxyhemoglobin increase. That's a good study. Here's a study on stem cells, so I'm not making it up. We can say that we stimulate proliferation, but I think you have to have, stem cells to wake up in that area, resident stem cells. And then here's a couple more studies that based on the TECAR therapy, we can reduce pain, stiffness, and functional limitations in patients with knee osteoarthritis. And I know Dawn is going to talk a little bit more about that. And this is one of my favorite photos that I actually love, because it shows what happens to bone after impact or other tissues. And the message is collagen starts to separate. Bone starts to separate. It gets bigger. It at the end stages as like a callus formation, but at first it really does pull apart. And we're good. Winback is good for collagen repair, for microfractures, for bone healing. And these fibers, they literally uncoil. And on a cellular level, inside cells, the proteins uncoil, which is a bad thing. And then you've got fluids pushing around in the cell itself, intracellularly and extracellularly in the extracellular matrix. And sometimes I think we should push hard, really hard with our tools to iron out the areas, whether you think you're doing it for the fascia or to release collagen or bone itself. Pushing hard, pushing things back together is probably a good thing. It just depends on patient tolerance. And many of you were probably taught something like this, for the acute application. And by the way, bio means biostimulation, because TECAR is known for its ability to promote tissue healing and pain relief through biostimulation. And it might just be like, 10% for 15 minutes for the biostimulation and some pain relief. That could be the pads. I think Grant may share something like that. But when you've got chronic issues or these really dense or adhesive or fibrotic tissue, you have to go hot. Maybe into at least like the 40%. You have to get into these higher temperatures to get that arterial and venous system and vascularization and the collagen synthesis. So I go very hot, on these chronic applications. But just let's be clear, both CET and RET influence the fascia based on the information, that we know. And I think